interesting interview we're about to do now on addiction. Never a simple issue. This is something that obviously has been studied and treated for decades. Recently, some new trends showing up that could be changing the landscape. So joining us now, Hazelden Betty Ford's Chief Medical Officer, Dr. Alta Deroo. Dr. Deroo, thank you for joining us here on Fox 9 all day. Interesting stuff here that you're talking about. Let's start with the GLP-1s. Now, very popular weight loss drugs. A lot of people are using a lot of different varieties of these that curb your, I guess, desire to eat. And there's some studies suggesting too that it curbs your interest in alcohol, for example, that it may be an addiction treatment as well. How much do we know about how much it curbs your just interest in say, drinking alcohol versus an addiction to it?
Yeah, thanks for having me on to talk about this. I'm excited about this too. Any medicine or any tool that we have to curb substance use disorders is always very exciting for us. So GLP-1 agonist is that active ingredient that you may see in Wegovy or Ozempic, and yeah, they act in the gut, but then they also act in the brain. And a bunch of folks who were taking medications like Wegovy or Ozempic found anecdotally that it was also curbing their desire to drink alcohol and to use other drugs, actually smoking too. And so there started to be studies being done in rats and found that the evidence was mixed, and now there's more evidence more studies being done in human studies that show that there is potential for using a GLP-1 agonist to curb that craving for alcohol when somebody is also using it for weight loss. So it's not quite FDA approved yet, but there has been some compelling evidence to show that those folks who are already taking it for weight loss also have a substantial decrease in their cravings for alcohol.
And then at what point can you look at the connections between the cravings and the actual addictive component that may be in your genetics? How far can that extend?
Yeah, so I'm glad that you mentioned the genetics component. So genetics make up about 40 to 70% somebody's risk of developing an addiction, and there are some opportunities out there for people to do gene studies to see if they have a propensity for addiction. Those are live and out on the market. A lot are self-pay, and they can tell you if you have a increased risk for possibly a certain liking of a drug, of a medication. So maybe avoid opioids if it shows that you are genetically predisposed to having a higher risk for addiction for a certain opioid. And some genetic tests out there will take a sample of your saliva and then also do a behavioral risk inventory to see if you have the characteristics of somebody who would be at a genetic predisposition to developing a substance use disorder, and that's usually characterized as moderate to high. And those are alive and out on the market already. It doesn't provide a diagnosis of any type of addiction, but what it does is it provides a personalized approach to your healthcare so that you can make decisions going forward if you want to maybe alter your activity and take yourself out of those risky situations where you may be drinking a lot or using drugs. So it's just another tool that people have for decision-making process.
Well, I know that there's been, I've heard of research for decades about the hereditary components of addiction. Is the testing, how recent or new is the ability to do this genetic testing then to see if you've got that hereditary risk? This is advancing currently, right?
Yeah. So they've really become popular probably within the last 1 to 3 years. But yeah, they're out there on the market. Anybody could look it up and take this questionnaire and put some saliva in a tube and mail it away. And it lets them know if they're at risk for developing a substance use disorder.
Well, that's interesting developments. And then the developments too, again, going back to the GLP-1s to see if those can then reach the addictive part in your genetics. versus just say the cravings or such. That'll be interesting to see how that continued study can paint a picture of how to reach those addictive parts in your brain and in your genetic makeup. Let's move on to non-opioid pain medications with the FDA's approval of a new non-opioid pain treatment. Obviously, the opioid epidemic, and we've seen so much of that now about the rise of the opioids, about pain being was it the fifth vital sign, but then how that just the addictive nature of that. What is the significance here of a new non-opioid pain treatment? I imagine it's very significant. What are you seeing?
So I also share with you the excitement and the significance, recognizing the significance in this. So traditionally, yeah, we would manage just acute pain with something like ibuprofen or Tylenol. But when you go in for a surgery, you have a baby, you have a C-section, you have some type of orthopedic procedure, traditionally we've gone to opioids for prescribing that for pain medication. When somebody wants to avoid opioids, we use more Motrin, more Tylenol, or maybe even gabapentin. So there's been a new FDA medication that came on the market that's actually not an opioid, but in the studies, they show that it has worked on both large abdominal procedures, abdominoplasty, as well as bunionectomies and some orthopedic surgeries, as well as just general lower back pain or limb pain. And this is not an opioid. It's called suzetrigine. Suzetrigine is the generic name for it. And it came out about 2 months ago for FDA approval. And it can be prescribed right now. It would, the cost is about $15 per pill as opposed to Vicodin, which would be maybe $1 or $2 a pill, which is an opioid, of course. And the dosing would be 1 to 2 pills a day, but there's no dependence that developed with it. There's no addiction that's associated with it because it's not acting centrally in the brain and releasing that dopamine that people have gotten a euphoria from in the past. So it's actually working in the periphery and providing excellent pain relief. And I find it really encouraging because when people did have a tooth pulled or a large dental procedure or abdominal procedure or back pain, opioids were our most powerful thing, but now we have an option for this.
That's
a very powerful medication that matches this without the addiction. So very exciting.
Which could be significant in terms of what you see then down the road in treating addiction if we can cut it off at the pass, so to speak. What are you seeing in your treatment centers across the country now in terms of the trends here? I mean, we're still obviously dealing with opioid addiction issues that just continue to reverberate. Is that still the biggest thing? Are there other trends?
Alcohol is the biggest thing. Alcohol is still the biggest thing. That's the leader out there right now. And so we're seeing a lot of off-label medications used for alcohol. Sometimes we see gabapentin used for medications. Traditionally, we use acamprosate, naltrexone, disulfiram, which is Antabuse, some of your folks may be familiar with. But alcohol is number one. And countrywide, we're seeing a rise in the stimulants. Methamphetamines, cocaine, that type of thing. So opioids and methamphetamines are about the same, but we're seeing a sharper increase with methamphetamines. But that's the whole country in general.
Do you have any indications as to what spurred that rise? I mean, any insights here?
It's cheap to make, and people can create it at home. And so when you can create it at home, or you can create your own lab and you can make a methamphetamine, you can sell it cheaply and you can buy it cheaply. One thing about methamphetamine is that it is highly addictive. And so the euphoria that you would get by taking methamphetamine is higher than any other drug out there. So even if you were to take something like fentanyl and you get a slow sense of euphoria, you have a slow onset with that high. Methamphetamine increases your dopamine levels more dramatically than any other drug out there. So that's why we're seeing a higher proponent of addiction, because it's easier to get addicted. You get addicted faster to something like methamphetamine when it spikes your dopamine release, and that euphoria is a quicker onset. So that's how people become dependent on it and seek that great feeling from the methamphetamines.
All right. Thanks so much for joining us. Got to wrap this up. Be very interested to see here, over the longitudinal kind of study of this, to what some of these, certainly the non-opioid pain medication, the GLP-1 studies here on addiction, and what some of this genetic testing can do to help people sort of get ahead of this as well. A lot of interesting stuff. Thank you so much. All right, that's a fascinating topic, and it's and sadly one that never goes away. We've been dealing with addiction issues for forever, various forms of things over the centuries, over the millennia, and it just evolves into new things, but then new ways to try to get ahead of that, maybe stop it, and certainly treat it after there's a problem that develops.